Cow milk and eggs are the most common triggers of allergies in children, and this morning we have Dr. Kiragu from the Aga Khan University Hospital to talk about this. Karibu Daktari.
Thank you so much for the invitation.
Introduce yourself.
So my name is Dr. Elizabeth Kiragu. I am a pediatrician by training, and I'm also an allergy specialist. I work at Aga Khan University Hospital, Nairobi, in the Department of Pediatrics.
Take us through allergies. What are they, and what are some of the pointers that a parent or a guardian can pick in a child?
First of all, we define allergies as a reaction which is mediated by the immune system. The immune system is that part of the body which actually fights infection. So sometimes the immune system misbehaves. There's no other word to put it. It misbehaves, and it starts targeting or responding to normal things. And these are normal things that are usually tolerated by majority of the population. And then these allergies have different ways of presenting themselves. So we have allergies for the what you call respiratory allergies. So they can affect your eyes, your nose, asthma. That is the allergy for the airway. We have allergies for the skin, like eczema. We also have urticaria, which is hives. So those are people who keep saying they're breaking out in hives. And then we have food allergies, where people are responding to normal amounts of certain proteins in foods. And then we also have allergies to drugs as well. Yeah, so there's a broad manifestation of how a patient can react to different things.
In terms of pointers as a parent or as a guardian or probably a teacher in school, how would I tell that a child has reacted to a particular allergen, as you call it technically?
Number one, it also depends on what that patient is presenting with, okay? If you have a child who's always having a cough, right? And this cough is mostly dry, mostly at night, happens when they're in certain situations. For example, they are running or they are laughing. It's not normal for you to start coughing when you're laughing, to be honest. It's also not normal for you to start coughing or having difficulty in breathing when you run. When the weather changes, when they go to certain environments where they are playing with a dog. So that is a child who's most likely having asthma, okay? If the same thing happens and the child is having a lot of runny nose, sneezing all the time, I used to be like that. I used to have 3 handkerchiefs in school every day.
Yeah.
Because I was ever sneezing, I was ever itching my nose was always blocked, my eyes were itchy. So those are certain pointers to respiratory allergies. When it comes to food, again, not all allergies behave in the same way. And this is something I think many people need to understand, is that not everything that itches is an allergy.
It's an allergy.
Not every skin problem is a manifestation of an allergy. Because we are in a situation where so many people assume that it's a food, and they start manipulating that child's diet. So you start eliminating very important nutritious foods, which is actually detrimental for that child's weight, so they don't grow well. If you're thinking that your child might be having a particular allergy, it's better to consult, especially before you start manipulating their food. There are some patients who all they will develop is diarrhea, chronic diarrhea, failure to thrive. The others who will get the hives you're talking about, or swelling of the face. And the patterns of it is what tells you what the likely cause is.
Okay.
Yeah.
Child comes to you and they presented with one or more of these symptoms.
Yeah.
What treatment or maybe management is done?
Well, the first thing we do, the most important bit, is to take a very, very thorough history. It can take long, up to 30 minutes or 1 hour, because you really need to understand what is the likelihood of what mom is suspecting being an actual cause, okay? And then we do a physical examination, because we are trying to find out whether there are any signs that we can pick on examination. Many times parents don't even know their child is having problems with the nose until I look up the nose and find that the turbinates are so swollen, they're almost kissing like that. That's why the child is always breathing through the mouth. They're always licking their lips, so now they're starting to have eczema around the mouth. And then thereafter, I decide whether this is a child who would benefit from allergy testing. And there's a misconception that there's only one type of allergy that exists. Therefore, there's only one type of test I can do for the allergies. So that's always a discussion we have with parents. Because there are some tests which we do for immediate types of allergies. For example, if I ate nuts today and I start coughing, I can't breathe, my eyes are swollen, I would benefit from allergy testing of a certain type. If I have a child who took milk, for example, and started having a lot of vomiting and diarrhea and actually got into shock, that's a different type of test. So the tests are dependent on what that patient actually has.